Welcome into The Explainer. Today we're putting on our detective hats to investigate a condition that affects millions of children all over the world. But here's the thing, it's often more of a clue than a diagnosis. We're talking about anemia, and we are going to treat this like a full-blown medical mystery.
So if you've ever seen these symptoms in a child and felt that pang of worry, you are definitely not alone. But what's really tricky is that these signs, being pale, tired, or irritable, often don't even show up until the condition is pretty advanced. They're all tied to a drop in hemoglobin, which is the super important protein inside our red blood cells that's responsible for carrying oxygen everywhere in the body.
Okay, so what is anemia, really? Well, at its very core, it's just a shortage of healthy red blood cells. But that simple definition can be a little misleading. See, anemia isn't a disease in itself. Think of it more like a clue, a big flashing sign that something else is going on in the body that we need to figure out.
So, how does a doctor even begin to solve a mystery like this? Well, the first step is always to gather evidence from the scene. And for that, they use this incredibly powerful tool called the complete blood count, or CBC for short. This is what gives us the first set of data we need to start cracking the case. A CBC gives you a whole snapshot of the blood, a ton of information. But for our investigation, we're going to zero in on one key piece of evidence: the red blood cell indices. These are basically a set of measurements that tell us about the size and shape of the red blood cells. And trust me, they are absolutely crucial for what comes next. All right, let's really get into it. The first major breakthrough in pretty much any anemia case comes from looking at the size of the red blood cells. It's a measurement called the mean corpuscular volume, or MCV. And this one number, it acts like a sorting hat, immediately dividing all the possibilities into three distinct categories. So what if the cells are smaller than they should be? This is called microcytic anemia, and that clue points our investigation down a very specific trail. We start looking for culprits like problems with iron or issues with how hemoglobin itself is being produced. Okay, but what if the cells are a totally normal size? Well, that's called normocytic anemia, and it sends us down a completely different path. This could point to something like recent blood loss from an injury, or maybe even an underlying chronic illness like kidney disease that's messing with cell production. And finally, what if the cells are unusually large? Now we're looking at macrocytic anemia. This trail often leads us to things like a deficiency in key vitamins, like B12 or folate. And just like that, one simple measurement has split our whole investigation into three clear paths. Pretty cool, right? So after we've got the cell size figured out, our investigators look at a second critical clue, the reticulocyte count. The easiest way to think of this is like checking the production line at the red blood cell factory in the bone marrow. Is the factory running slow and not making enough new cells? Or is it working overtime trying to make up for a problem somewhere else in the body? Now, here's where it gets really elegant. By combining those two major clues, the size of the cells and the production rate of the factory, we can categorize almost any anemia into one of three main groups. This is how we really start to get to the bottom of things. So what's the story here? Is it a production problem where that bone marrow factory just isn't making enough cells? Is it a destruction problem where the cells are being made just fine but then getting eliminated way too quickly? Or is it a loss problem where the cells are literally leaving the body? Our clues point us to one of these three scenarios. Okay, now that we have our investigative framework, let's focus our attention on the most common culprit in the entire world: iron deficiency. This is your classic production problem, and it results in those small microcytic cells we talked about. I mean, look at this number. Iron deficiency is the prime suspect in a staggering number of cases. We're talking up to half the world's population. It's especially common in young kids during those big growth spurts, when their body's need for iron just skyrockets. And if you look under a microscope, iron deficiency leaves a classic fingerprint. The red blood cells are microcytic, which means they're smaller than normal. And they're also hypochromic, which is a fancy way of saying they're pale in color. Why? Because they're missing that iron-rich hemoglobin that gives them their color and, more importantly, carries oxygen. But hey, any good detective knows you can't get tunnel vision on your prime suspect. You have to consider the lookalikes. And the main condition that mimics iron deficiency is something called thalassemia, which is a genetic disorder. They both show up with small cells, but the cause is totally different, and telling them apart is absolutely critical for treatment. So how do we confirm it's really our prime suspect? Well, a lot of the time, the most practical way to be sure is to just see how the body responds to treatment. It's like a therapeutic trial. If a patient starts taking iron and their hemoglobin levels start to climb within a few weeks, well, that's basically the confession that cracks the case wide open. And this brings us to what is easily the most important takeaway of this whole thing. Solving this mystery isn't just some academic exercise. Identifying the right culprit is absolutely essential for prescribing the right treatment and making sure things turn out okay. Because just treating all anemias with iron isn't just ineffective, it can be downright harmful. For instance, let's say someone actually has a vitamin B12 deficiency. If you give them a bunch of folate, it might make the blood test look better, but you're just masking the real problem while serious neurological damage could be happening in the background.
So at the end of the day, you have to remember this. A diagnosis of anemia is never the end of the story. It's the starting gun for an investigation to find out what's really going on. It is the symptom, not the final answer. So the next time you think about anemia, don't just think tired. Think mystery. It's a sign from the body, a sign that's prompting a really important question. Why? Answering that question is the real key to solving the case, and ultimately the key to a healthy outcome.